Hi friends, my name is Latifatud Dini, and I want to tell you about some effects of the bacteria. The name of the bacteria is Staphylococcus aureus. The discussion topics are definitions, symptoms, causes, treatment, prevention, frequency, and death. What is the definitions of Staphylococcus aureus? Staphylococcus aureus is the most dangerous of all of the many common staphylococcal bacteria. This gram-positive, spear-shaped coccal bacteria often cause skin infections but can cause pneumonia, heart valve infections, and bone infections. The symptoms of staph infection depend on the type of infection. Skin infections can look like pimples or boils. They may be red, swollen, and painful. Sometimes there is a pus or other drainage. They can turn into impetigo, which turns into a crash on the skin, or cellulitis, a swollen red area of skin that feels hot. Bone infections can cause pain, swelling, warmth, and redness in the infected area. You may also have chills and a fever. Endocarditis causes some flu-like symptoms, fever, chills, and fatigue. It also causes symptoms such as rapid heartbeat, shortness of breath, and fluid build-up in your arms or legs. Pneumonia symptoms include a high fever, chills, and cough that doesn't get better. You may also have chest pain and shortness of breath. What causes staph infections? Some people carry staph bacteria on their skin or in their noses, but they don't get an infection. But if they get a cut or wound, the bacteria can enter the body and cause an infection. Staph bacteria can spread from person to person. They can also spread on objects such as tools, clothing, door handles, athletic equipment, and remotes. If you have staph and don't handle food properly when you are preparing it, you can also spread staph to others. What are the treatments for staph infections? Treatment for staph infections is antibiotics. Depending on the type of infection, you may get a cream, ointment, medicines to swallow, or intravenous or IV. If you have an infected wound, the provider may drain it. Sometimes you may need surgery for bone infections. Some staph infections, such as MRSA, methicillin-resistant Staphylococcus aureus, are resistant to many antibiotics. There are still certain antibiotics that can treat these infections. Can staph infections be prevented? Yes, of course. Certain steps can help to prevent staph infections. First of all is use good hygiene, including washing your hands often. Don't share towels, sheets, or clothing with someone who has a staph infection. It's best not to share athletic equipment. If you do need to share, make sure that it's properly cleaned and dried before you use it. Practice food safety, including not preparing food for others when you have a staph infection. If you have a cut or wound, don't forget to keep it covered. What is the frequency and death caused by Staphylococcus aureus? Gram-positive pneumonia due to Staphylococcus aureus accounts for a higher mortality rate, 41%, compared to that caused by gram-positive bacteria that most commonly cause pneumonia, namely Streptococcus pneumonia. Osteomyelitis mortality rate is 5 until 25%. Acute osteomyelitis is a disease that usually caused by Staphylococcus aureus. The rate of death for endocarditis among those infected with bacteria is around 25%. Men are more affected than women. Well, because the discussion of the material has finished, then allow me to say goodbye to you all guys. Sorry if my pronunciation aren't perfect yet. Thank you for your nice attention watching this channel. See you guys!